And we are very fortunate to have with us one of the leading experts when it comes to COVID-19 response in our area. Dr. David Kirschke is Medical Director at the Northeast Tennessee Regional Health Office. Thank you, Dr. Kirschke, for joining us today. We appreciate your time as always.
Yeah, good to be here.
Thank you. Now, I want to make sure we're all caught up on the big announcement today regarding the drive-up testing locations. And the Department of Health, your department, is working very closely to coordinate that. This is, it seems, a departure from the previous way of doing things. How is this different than what we've had before?
So basically, we're just offering more testing. So we're trying to increase testing just to have more data. Particularly in coming weeks when we're trying to decide whether it's safe to open up certain parts of the economy. So we're just trying to increase testing overall to make sure we're not missing cases. So we will be testing 7 days a week. We have been testing 5 days a week in every county, but now it'll be 7 days a week. Just a little bit easier to get testing, more locations, and then also those weekend testing sites.
Is a free test, and you're saying 7 days a week, and it's important to mention that's because county health departments are also offering these free tests Monday through Friday, right?
That's correct. So anyone that needs to get tested can get tested in any county through the health department, but we will have larger testing sites in certain counties.
We will have that information if you're tuning in and you want to know where that is. It's posted right now on our website. Dr. Kirschke, the Commissioner of Health today, was very clear that this is not just for those people who are having those traditional symptoms that we've been talking about, the chest cough, the sore throat, the persistent fever. They were very pointed, it seemed, Dr. Kirschke, to say it could be if you just don't feel right. What's going on here? Why are we seeing the symptoms not so much being limited now?
Yeah, so the people most likely to have coronavirus will have those classic symptoms of cough, fever, and shortness of breath. But we have seen, in some cases, people with very mild symptoms are positive. Some people with atypical symptoms like diarrhea. And then, again, occasionally people with no symptoms at all. So, but the people most likely to have coronavirus will have those typical symptoms of cough, fever, shortness of breath.
You're going to have a portion of the population, I would think, who just wants to know if they're in that asymptomatic group, the carriers who have it and don't even know it. Are they welcome to come for these free testings?
Yeah, so we will be testing anyone. So to catch an asymptomatic infection, you know, it's like a very low probability that we're actually going to find it. But, you know, if people just want to know, they can do that. The problem with testing someone that's asymptomatic is that, you know, there's a low likelihood the test will be positive, and the negative test doesn't mean that you're not going to get coronavirus within the next week or months. So the negative test doesn't really help us. You know, there is a rare chance we might find someone that's asymptomatically infected who otherwise wouldn't know it.
You know, we've been tracking the curve and talking about flattening the curve. It seems to me that as we now open the door wide for more testing, we're going to see numbers continue to go way higher. So looking for perspective from you, what are you going to be looking for as a public health official that will guide us in the next few weeks as we start to talk about reopening businesses, kind of restarting life as we knew it?
Yeah, well, actually, we don't really know if the numbers are going to go higher. So it's unclear whether we're catching most of the cases currently with the way we are doing testing, or whether opening testing up will find a lot of cases we didn't know about. So that's really one of the reasons we're doing increased testing, to see if there are, you know, there is transmission going on in the community that we don't know about, or cases we have not detected yet. So I think this next 3 weeks, this push for the increased testing will give us data to know really where we are on the curve.
We're seeing case counts go day by day, county by county, up by single digits. We're seeing every once in a while we'll get a word that someone's passed away related to COVID-19. It is not what we thought we were going to be seeing at this point a few weeks ago based on some modeling. Are you beginning to feel like a bit of a relaxation, or not relaxation in the need to socially distance, but a relaxation that, okay, maybe we're doing enough to keep this where it needs to be?
Well, certainly I'm encouraged that the social distancing seems to be working, But there are things that keep us up at night as epidemiologists and public health workers. So, we really worry about, if we get a case in a nursing home, there could be a lot of transmission, and those people are at high risk for bad outcomes. Also, among the homeless, people in homeless shelters, inmates in jails. So there are definitely situations that we worry about, but overall the numbers, like you said, have only been going up in the single digits. We've not seen situations like in other parts of the country where there's doubling every 3 days or anything like that. So I definitely think that everyone's efforts at social distancing and prevention have been working.
And we continue to hear that that's great, but if we kind of slide back, if we release the intensity of our efforts, that we might see that surge. Is it still a possibility, based on what you're seeing today, that we could see a surge that really could be seriously impacting our healthcare facilities and the population in general?
Yeah, so we have flattened the curve, but that also means that we have a lot of people in our area that are still susceptible to coronavirus. So any reintroduction of coronavirus, if we do, or when we do relax social distancing, could cause an outbreak. So it'll be really important. One is, how the economy is reopened. So I don't think anyone's talking about just going back to normal. So still will have to be social distancing and prevention going on for months to come. So, it's not, I don't think it's going to be, I don't think we can just open it up and expect there not to be increased cases. So the other thing that's going to have to happen is public health is going to have to be, there's going to have to be a lot of testing. And anytime there's a flare up, just like, someone sitting in a fire tower looking for little smoke signs of forest fires, we're going to have to be doing a lot of testing to find little areas where there's transmission going on and make sure we get isolation and quarantine in effect in those areas to try to control that.
Dr. Kirschke, so many tonight, this will be my final question in our time that we have with you right now. So many tonight are wondering, when can I go back to church? When can I go see my grandma? When can I do any of the normal things that I used to do that I'm now having to stop from doing regarding being social and being together with others? Any indication for them tonight of when that might be a possibility?
So hopefully we're going to get more data to be able to answer that in the coming weeks with the increased testing. But one of the things you mentioned, going to see grandma, even if we do start to relax a little bit, it's still going to be those most high-risk people, the elderly, people with pre-existing medical conditions that put them at high risk, that we're really going to have to be careful with, and that may still have to really practice that social distancing. So we're also going to have to do things to protect them. So we don't really know, what's going to happen, but hopefully we'll have more data from this increased testing to be able to give both public health and, the government information to work on to figure out how to do this most safely.
The new reality until we get a vaccine, right? I mean, that's basically
Yeah, definitely.
it.
We would love to have a vaccine. So the vaccine would obviously make it easier to reopen, get schools back going and everything. But until that point, social distancing and all those prevention measures that we've been talking about is what we're going to have to rely on.
Dr. David Kirschke with the Northeast Regional Health Office, a busy few days ahead for you and your team as we expand testing. Thank you for always being accessible. We appreciate it.
Yeah, thank you.
Stay with us. We'll continue our coverage of the evening's news here on News Channel 11 in a moment.